This is the recording for the Occupational English Test, and the test is held at Medcity International Academy, Kannur on 8th December 2023. The candidate's name is Manju Adhikar and the candidate number is 100122. The interlocutor is Roshni and the interlocutor number is 286693. This is role play number 1 for the profession of nursing. Good afternoon, Manju.
Good afternoon, ma'am.
May I see your identification, please?
Sure, ma'am.
Okay, here you go.
Thank you.
This is a test of your English language and not an assessment of your professional knowledge. Keeping that in mind, speak as you would naturally. We will move on to a warm-up session to get you started. This is not assessed in any way. Okay, shall we move on?
Yes, ma'am.
Okay. So Manju, tell me, why did you choose nursing as a profession?
Frankly speaking, I never wanted to enter into nursing. So many of my cousins who are staying abroad, they always used to share some new experiences, which I thought is very good. And I think I'm a type of a person who doesn't like doing the same thing again and again, which made me go into nursing. And once I started doing nursing, I really enjoy it.
Okay, great. And do you have a role model?
Well, as I told you that my cousins used to tell me all the stories. So one of my cousin's sister is my role model because the way she used to share me things and the way she used to tell me that the way she has changed one's life, that made me do this nursing.
Okay, great to know that. And what do you think are the challenges that nurses face in their profession?
I think, ma'am, there are many challenges, but the main challenge which I face, as I already have experience, is more working hours. As we have 8 hours of shift, it's not necessary that we always get to work for 8 hours. It can be more than that. So for people who already have children, who have the family with them, it becomes a little difficult for them. So I think this is the most important thing which I feel.
Okay, and what do you think are the qualities that a nurse should have?
I think, ma'am, there are many qualities, but according to me, communication is something which a nurse should possess. Because if you'll communicate with the patient, then you'll know more in depth about the patient. Once you know more in depth about the patient, you'll be able to give him the care what he wants. So I think communication plays a very important role in this.
Okay, great. Okay, Manju, that's the end of the warm-up session. Let's move on to the role play now. I'll be taking the part of the patient or the bystander and you take the professional role. The role play will last a total of 5 minutes and you'll be given 3 minutes to prepare for the same. The role play intends to get evidence of your ability to perform effective communication with patients. Do you have any questions?
No, ma'am.
Okay, so we shall move on to the role play. This is your role play card. Here is your pencil and your 3 minutes preparation time for your role play starts now. Okay, Manju, that's the end of your preparation time and your role play time starts now.
Good afternoon, Mr. Chan.
Good afternoon.
How are you doing?
Yeah, fine, I'm fine.
That's good to hear. From the case note, I see that you have undergone a hip replacement surgery 3 days back. Am I right?
Exactly.
And also, after looking at the condition, the surgeon has decided for a discharge tomorrow. So I have come here to discuss regarding the discharge plan.
Tomorrow? I
Yes.
feel that's too early.
Well, that is quite understandable, Mr. John, but let me tell you that looking at the condition only, doctor has decided, as you were just as doctor has seen you just walking around, and he just decided that you are fit to go home.
Yeah, actually I have started to walk around independently, and in fact I have taken a shower independently today, but you know, after that I felt exhausted, really exhausted, so I'm afraid that I might fall.
Well, that concern is quite valid, Mr. John, but let me tell you that recently only you have undergone surgery, so it might take some amount to regain your independence fully. But I just wanted to know that do you have anyone from your family who can just be with you until and unless you don't regain fully?
Actually, I have a lot of people in my house, but I don't think I can avail them throughout. So I prefer staying here because I have you people around me always.
I can totally understand that you
Yeah.
want to stay in hospital as we are there to look after you. But let me tell you, Mr. John, as you will stay in the hospital for few more days, there are chances that you might get infection. So it's better for you to go at home. And also, as you told me that you have many family members who can look after you. So I think that's a good option to go home and take rest.
But see, no, what I said is that like I have people, but they won't be there throughout. So what if I fall? Like here I have medical assistance throughout, right? But that's not the case when I go home. So that's my concern.
Well, I can totally understand. But let me tell you, John, I will make sure that one of the family member will stay with you all the time. So you do not have to worry about that. And as you told me regarding the fall, I'll make sure that necessary equipments will be around you so that you will not land up into such serious complications.
Okay, then
I hope
that's
that
fine.
sounds good.
Yes, that's fine then.
And also, as you told me about your mobility thing, I just wanted to tell you that a physiotherapist will be educating you as well as your family members regarding your mobility.
Okay.
And also the physiotherapist will be giving you some kind of exercises which you have to perform daily so that you will be able to regain fully and you will just be able to recover fully.
Okay.
So I hope that sounds good to you.
Yes, true.
So do you have any other concerns?
I would like to know about my medications, when and how I'll receive them.
That's a very good question, Mr. John. Let me tell you one, before you getting discharged from this hospital, pharmacists will be delivering medications.
Okay.
So once the pharmacists deliver medications in our facility, I'll be the one who will be telling you all about the medications, when and how you have to take.
Okay.
So you do not have to worry about the medications. So we are there to help you. Okay, Mr. John?
Okay, fine.
So do you have any more concerns?
Actually, I'm also concerned about looking after the wound area on my hip. I don't know anything about that.
Well, Mr. John, I'll be the one who will be telling you what all things you have to check for. As if you can see any of such complications, we are there to help you. And also I'll be telling in advance what all things you have to look for.
Okay.
If you see any such kind of complications, you can anytime make an appointment to see the GP, so that he'll be able to help you.
Okay, fine.
So does that sound okay to you?
Yeah, fine.
And also I would like to tell you regarding the major concerns, as you told me that if you will have any major concerns at that time, what you have to do.
Yes.
So can I?
Yeah, sure.
So as you have a wound in your hip area, if you constantly have pain, excessive pain, despite taking, as I have given you medications, what all medications you have to take for pain, and despite of taking medication, you still complain of pain, at that time it is very important to seek emergency help.
Okay.
Secondly, if you see bleeding from your wound area, as you can see bleeding or anything, any pus coming out, a yellow discoloration coming out from the wound, that is considered to be the complication. So at that time it is very important to call the GP on the spot, because he will be the right person who will be able to look after you.
Okay.
Along with bleeding, pus, if you can see that your temperature is above 38 degrees Celsius, which is considered that you might have landed into infection. So at that time also it is very important to call up the hospital.
Okay, Manju, that's the end of your role play. Thank you.
Okay, thank you.
Medcity International Academy. Trusted hands forever.